Thank you. I'm Dr. Sartaj, an interventional cardiologist with Alamo Cardiovascular Consultants. We know COVID 19 can attack the heart, damaging your heart muscle and causing blood clots. Don't ignore your symptoms. We're here to answer your questions and help protect your heart. Don't delay. Your safe care is our priority. Well, so it's very interesting. The first two cases I did with this outbreak were delayed presentations. There's a thing called a STEMI, which is a heart attack when the vessel is 100% occluded. And basically, every minute you lose, you're going to irreversibly damage part of your heart muscle that you're never going to get back. That's kind of a very disheartening outcome. And a lot of people, even though they were having symptoms, chose to stay home because they were worried about contracting COVID, going to the emergency room or to the hospital. So actually, what we call delayed presentations of this type of heart attack that actually hurt a couple of my first patients. And so I want to get the message across that if you are having symptoms consistent with heart ailment, especially a heart attack, then do not delay your care. You need to be at the hospital and be seen pronto. Now, the fevers, the body aches, the cough can usually be treated at home. But if you're feeling that you can't breathe, that's absolutely a reason to go get checked out. The other questions that I'm getting about COVID 19 are related to the heart. What all things that COVID 19 does to the heart. As we move along, we're learning more. We're still in the kind of initial fact finding process in this, but it affects the heart in multiple different ways. COVID 19 can make the blood what we call hypercoagulable, which means it clots more easily, and you can form clots in small blood vessels that can cause injuries to the heart muscle itself. We have inflammation of the heart muscle happening directly, which other viruses also cause, but this can cause it to an even more higher severity. It's called myopericarditis, which is inflammation of the heart muscle itself, plus the coverings of the heart. Heart sits in a sac, a double layered sac, with fluid in between it for lubrication so it can beat those billions of times in our lifetime. And it can cause inflammation of the sac and cause excessive fluid to accumulate in that sac, which can cause pressure on the heart muscle. We are also seeing a lot of heart arrhythmias. Arrhythmias are abnormal heart rhythms, either a too slow a heart rhythm because of rhythm blockage or too fast because of irritation of the pathways. So we're seeing both those types of arrhythmias. We are seeing people that present with weakness of the heart muscle called cardiomyopathy, which in turn leads to congestive heart failure. So we're seeing basically the whole gamut, the whole spectrum of cardiac disease. We are seeing, because of the clots, we're seeing heart attacks also. And because a lot of these people that require high levels of oxygen or even mechanical ventilation, they have very, very high oxygen requirements for the heart because the body's working at a higher level, and they will develop heart attacks regardless. So, we're seeing a lot of those in patients that are in the intensive care units. So these are difficult times for all of us. This is unprecedented. This is probably the first time in my lifetime or my parents' lifetime we're going through something like this. But I want everybody to be assured that we have enough bed capacity in our hospital systems, and we have a very dedicated staff, all the way from housekeeping to respiratory techs to nurses to doctors and to administrators that are working 24/7, making sure people get adequate care. So don't be afraid to seek care if you need it. Reach out to your physician if you think that's appropriate. But if you think you need to be seen in the hospital, don't be afraid to go there. We're triaging everybody very well. The patients with COVID-like symptoms that could potentially have COVID illness are right from triage put into a separate area so that we do not cross-contaminate people that may be presenting with something else like a heart attack. So everybody is safely and effectively being taken care of.